Thank you for tuning in today to watch this Medicare Basics video, brought to you by Medicare Pro. Let me introduce myself. My name is Randall Garcia, and I am the owner of Medicare Pro. Today, you're going to get so much information about Medicare, about some plan options, about enrollment periods, everything that you need to know in a very short amount of time. So I'm not going to give you any fluff. We're going to cut straight to the content, and so that way you can get everything that you need. Let me tell you a little bit about Medicare Pro. We are an award-winning, licensed, certified, rigorously trained, independently owned insurance brokerage specializing in Medicare. We're faith-based and family-owned. We're passionate about serving our community and helping people understand their insurance options. We're honest, friendly, down-to-earth, and always helpful. Best of all, we're professionals. Here's who we're not, and I hope that you get this. We're not these 1-800 telesales agents. We're not salesy, pushy, dishonest. We're not going to twist your arm. We're not going to do any of that. We are going to educate you on Medicare. I always like to say we make Medicare easy. We really, really do. And so it's very important for us to get this right. We want to get it right on the first try and help you feel confident in your plan selections. And we have a 4-step process. We like to say this: let us help put you at ease. And ease spells out where I'm taking you today: educate, analyze, select, and enroll. So I'm going to educate you, help you analyze your options, help you select a plan, and help you enroll. This is what we do for every client. So let's start with education. Right? We're going to start with some eligibility and original Medicare information. We're going to compare supplement versus advantage and talk about enrollment periods. So eligibility. Who is eligible for Medicare? Well, you have to be 65 years and older to qualify, or you can be under 65 with certain disabilities. And if you need to enroll in Medicare, you can do that through the Social Security Administration 3 months before your eligibility date. SSA.gov is your website to go to. Original Medicare, you're going to get a card like this for 2023. It looks like this. It'll have your name on it. It will have your Medicare number with random numbers and letters with Part A and Part B effective dates. So your card's going to look just like this. But what does it cover? Let's start there. What does Original Medicare cover? Well, I'm going to start right here at the top of our screen to talk to you about Hospital Part A. Part A is typically a 0 monthly premium if you've worked your 40 quarters and paid into Medicare. If you haven't, well, you're either going to pay $278 a month or $506 a month, but most individuals will pay 0 monthly premium for Part A. If you go to the hospital under Part A and you're using Original Medicare, you'll have a $1,600 deductible per admission. All right, this covers your first 60 days in the hospital. So whether you're there for 1 day or 20 days or 60 days, you'll have that $1,600 deductible to pay. Once you've exceeded 60 days, you're going to pay $400 per day, days 61 through 90, and then after 90 days, you have to pay $800 per day. That's a lot of money for 60 lifetime reserved days. Medicare Part B, this is your medical. It's usually about $164.90. The asterisks will show you there at the bottom of your screen that this is the standard premium for 2023, but this amount can go up or down based on income levels. If you qualify for Medicare Savings Program or Medicaid, this number can go down to 0 as well, or it can go up as high as $560.50 a month. This is for high income earners, but the standard premium that most people will pay is $164.90 for this year. It does have a deductible of $226. Of course, we remember that the deductible is what you pay first before the insurance kicks in. So this is a $226 deductible per year. Once you've hit that deductible, then you can see over there on your right that it goes 80-20. We want to make sure that you understand that Medicare pays 80% and you pay 20% after you've hit your deductible. Well, that's not the greatest coverage in the world if you stop there. That's why we look at supplement versus advantage. What we do is we're going to have two categories on your left and on your right. You can either choose a Medicare supplement, which is also called a Medigap, tomato, it's the same thing. Or you can choose a Medicare Advantage option, which is also called Part C. So I put the nicknames there in parentheses, but they are all the same thing. Option 1, Medicare Supplement. Option 2, Medicare Advantage. Here's 5 things to know about Medicare supplements. These are secondary insurance plans, which means that it pays second. So your Medicare pays first. And you can look at this real quick. Like if you have 2 cards, your Medicare, show your doctor your Medicare card, and then you have your secondary insurance card to cover the difference. That's what a secondary is. It pays after Medicare's already paid. So that's a supplement. It's a secondary insurance plan. There's no network and there's no referrals. So there's no HMO or PPO on this side. You can go wherever that Medicare is accepted, and you do not need referrals from the primary care doctor to see a specialist. There is health underwriting in certain situations, unless you're in your open enrollment period, which means you're in your first 6 months of Medicare eligibility, or sometimes you can skip the health underwriting if you have some guaranteed issue clause, which I'm going to get to a little bit more later. The monthly premiums on supplements are based on your age and your zip code. So you don't lock in your rate. When you're 65, you'll get a monthly premium, and every year that you get older, it will go up 3 to 5% on average. Medicare Advantage, here's 5 things to remember. It combines your Part A, your Part B, and your Part D all into one. So if you can imagine, it's actually the opposite of supplements. Supplements has Medicare first, the supplement is secondary. With the Advantage plan, it combines everything into one plan, and you're able to use one card for all of your services. So that's what Medicare Advantage does. Medicare Advantage is also network-based plans. So these are HMO versus PPO plans, and we'll get to that in a little bit. With Medicare Advantage, you must continue to pay your Part B premium, which you see up there at the top. It includes dental, vision, hearing, and a number of different items that are what we call extra benefits. Medicare Advantage also has financial protection that's automatically included to help you. Let's just quickly do a quick breakdown of what the cost looks like on a monthly basis. If you do a Medicare supplement, which is the secondary insurance, you're going to pay about $115. Now, this is ballpark. This is not a quote. Do not quote me. It's based on your age and zip code. So ballpark about $115 a month if you're 65 years old. And the Plan G is what we consider the highest level of coverage if you're turning 65 this year. And it should be about $115 a month ballpark on top of your Medicare Part B premium. So you have to pay the Part B premium up top. You have to pay the Plan G. You have to also get a drug plan that's separate. So very good coverage. It pays everything Medicare doesn't except for your Part B deductible. I can further explain that one-on-one, but just you have a $226 deductible with this setup, and then you're not paying anything else for the rest of the year except for maybe some prescription copays. Very, very good setup. Medicare Advantage, there's HMO and there's PPO. HMO, referrals are required. PPO, no referrals are required. I gave some ballpark estimates on the monthly premium, although both plan options have 0 monthly premiums. In our area in San Antonio, Texas, it does vary as well based on your zip code. Overall, HMO usually has lower copays, and PPOs have higher copays. HMO usually has more extras like more dental, more vision, more hearing on a typical basis. PPO, usually they have a little bit less. So usually people, they enroll into an HMO mainly because of the benefits. Wow, I want low copays. I want more extras. PPO people they're saying, you know what? I want freedom. I want flexibility to go where I need to go. And the good news is most HMOs and PPOs already have a Part D prescription drug plan included as a part of that setup. So let's go over enrollment periods. Medicare Supplement has several enrollment periods. The first one on Supplement is the open enrollment period. This is your first 6 months after your Medicare effective date. So let's say your Medicare began January 1st, 2023. You basically have until the end of June to choose a Medicare supplement with no underwriting. Underwriting is your health questions, right? They're not going to ask you any health questions. They must accept you. They can't deny you in your first 6 months. Guaranteed issue are special circumstances where you cannot be denied coverage. And sometimes this is like when you retire from an employer or union or group plan. A lot of times you'll get a guaranteed issue. You cannot be denied as well. There is health underwriting for people who do not have one of the other two enrollment periods. So basically you're going to have to answer a list of health questions. And if you're healthy, they'll accept you. If you have conditions, they can choose to accept or deny you based on those conditions. Remember with supplements, a lot of people get confused on this. There's no annual enrollment periods. You don't do this annually. When you choose a supplement, you choose a supplement and you keep it. There's no annual enrollment periods. It's just health underwriting or one of the other two. And so for people who are turning 65 after January 1st, 2020, just remember that Plan C and Plan F is no longer available. They phased those out, which is why earlier I showed an example of a Plan G, because any age 65 or older qualifies for a Plan G. Advantage enrollment periods. The first one's called the initial enrollment period. It's 7 months long. It includes your 65th birthday month plus 3 months before and 3 months after. 7 months total. And it begins 1 month earlier if your birthday is on the first of the month. You may enroll in Part A, Part B, or both during this time. Annual enrollment, this is where we talk about annual enrollment. You're going to see all the advertising. You know when it's here. You'd have to be living under a rock to not know it's the annual enrollment period. October 15th through December 7th is the annual enrollment period. And this is where you can change your plan, add, drop, or switch your Medicare coverage. Then open enrollment period, that's January 1st through March 31st. So if you have a Medicare Advantage plan, you can switch to another Medicare Advantage plan during this time. Or you can disenroll from your current plan and go back to original Medicare. There's also special enrollment periods for Medicare Advantage, like if you retire or lose coverage, if you move out of the plan's service area, if you qualify for extra help or Medicaid, maybe if you have a chronic health condition, or maybe there's a 5-star plan in your area. These are all special enrollment periods where you can change mid-year. Now there's many, many more special enrollment periods. This is just a quick list of some of the common special enrollment periods. The next thing that we do at Medicare Pro is help you analyze. So we help you do this. I would also recommend that you analyze your needs if you try to go about it alone. Of course, I don't recommend that, but analyze these things. Your doctors, right? We're going to start with your doctors. List these all out. Primary care, specialists, dentists. Who are your doctors? We also want you to analyze your prescriptions, and we can help you do that as well. So, what prescriptions are you taking? What's your dosage? All of that good stuff. We want to make sure that you qualify for your maximum coverage. So subsidy is if you get any help from the government. So people that are below the federal poverty income limit may qualify for LIS, QI1, SLMB, QMB. If you don't know what these acronyms are, that's okay. We can see if you qualify for basically, in layman's terms, help with your prescription drugs, help with your Part B premium, or help with your out-of-pocket costs on top of that. So we help everybody qualify for subsidies. So we don't just do doctor's prescriptions and subsidies, but we also analyze your conditions. So whether you have diabetes, whether you have heart conditions, whether you have lung conditions, we want to help put you on a plan that helps save you money and manage your conditions. After we've done these, after we've analyzed all of those things, we want to help you select a plan. So when we select a plan, we look at options. After we've done all these things, right? Doctors, prescriptions, your situation, your budget, we'll give you a list of a few plans that fit the criteria that you've given us. And then, of course, it's time to enroll. If you have any questions, we'll help you through it. It's an amazing process, and we can help you from A to Z. This is what we'll need is just your Medicare card, your form of ID. Make sure all of those are up to date, and we can help you with that. So how did I do on a scale from 1 to 10? I hope that you say that we gave you a 10. I'm taking new clients, we're taking new clients, and we'd love for you to save our contact information, like our business page, refer us. We would appreciate it. If you're working with an agent, I want to let you know that they have been rigorously trained, and I hope that you received 5-star treatment from your Medicare Pro agent. So let me know how your agent did, and I would be happy to reach out to you and just simply thank you for becoming a Medicare Pro customer. Finally, we did say that we're faith-based. We love what we do. We want to make sure that we're always performing at the highest ethical and moral standards. We will never twist your arm. We will never do you wrong. We will get it right on the first try. And if for some odd reason we don't, we will help you fix it, and we'll make sure that we're with you every step of the way. When you enroll with the Medicare Pro agent, you don't just get us at the time of enrollment. You get us for life. All right. So if you need something in 6 months, or you want to review your plan options next year, we're here to help you. As your situation changes, we're right there with you. This is personal attention that we believe in. You see, when many other people are enrolling over the phone with telesales agents, solicitors, they meet a new agent every time they call in. Every time you call a 1-800 number, you're getting Bob, and then you're getting Dave, and then you're getting Sarah. And nobody remembers your situation, and they don't know you. But with Medicare Pro, we begin the client relationship, and every year, as things change, or as you change, we change with you. We can help you. We can give you the updated information that you need to choose your plan option. So if we can help put you at ease with your Medicare enrollment, then that is exactly what we've come to do. That's exactly what our mission is to put you at ease. Let us handle it, and we'll take care of the rest. We hope that you've enjoyed this video. I hope that you've learned something. Next step is to contact Medicare Pro, contact your agent, so that way we can take you through it again. We can analyze your needs. We can help you select and enroll. I know that my agents will do an amazing job, and if you need anything, you can always reach out to us online at our website. You can email us for more information. All of our information is in our contact page, and we would be happy to serve you. Thank you so much for watching this video. We can't wait to help you with your Medicare.